Day 0. The bite. You're walking home at dusk when a stray dog comes out from behind a parked car. It's not aggressive, exactly. Just confused, stumbling slightly, drooling more than a dog should. You reach out, the way you would with any dog. It lunges and bites your hand. 2 puncture wounds, nothing dramatic. You rinse it under the tap, slap on a bandage, and move on with your evening. This decision, the next 10 minutes of your life, will determine almost everything that happens next. Not the bite itself. What you do about it. You don't go to the hospital. It's just a small bite. You've had worse from your own dog as a kid. What you don't know is that the dog's saliva now contains a virus that has killed more people throughout history than almost any other infectious disease, with a fatality rate, once symptoms begin, of essentially 100%. Not 99%. Not very high. Functionally, once it gets far enough, nobody survives it. The virus itself is shaped like a bullet, almost literally, a tiny bullet-shaped particle from a family of viruses called lyssaviruses. It's one of the most neurotropic viruses known to science, meaning it has an almost perfect, evolved talent for finding and traveling through nerve tissue specifically, while mostly ignoring the bloodstream that most other viruses rely on. The virus is already moving, not through your bloodstream, the way most infections travel, through your nerves. It's found a peripheral nerve near the bite site, and it's begun crawling toward your spinal cord at a slow, steady pace, somewhere around 1 to 2 centimeters a day. Right now, you feel completely fine. That feeling will last for weeks, maybe months. That's the part that kills people. Rabies gives you time to forget about it. Day 3, the window closing. You've forgotten about the bite already. It's healed into a small scab. You're back to normal life, work, sleep, dinner with friends. This is the window. Right now, today, a series of injections, a thorough wound wash, and a course of vaccine called post-exposure prophylaxis would stop this virus before it ever reaches your brain. It works close to 100% of the time if it's started before symptoms appear. Over 29 million people get these shots worldwide every single year after exposure to a potentially rabid animal, and the overwhelming majority of them go on to live completely normal lives. You are not one of those 29 million. You didn't think a small bite from a sick-looking stray was worth a hospital visit. The virus doesn't care that you've moved on. It's still climbing, nerve by nerve, toward your central nervous system, completely invisible, completely undetectable by any blood test or scan available today. There is no way to know it's there until it's too late to stop it. The exact timeline depends almost entirely on where you were bitten. A bite on the face or neck, close to the brain, can cause symptoms in as little as 5 to 9 days. A bite on the hand or foot, far from the brain, can take months, occasionally over a year, because the virus has so much farther to travel along the nerve highway before it reaches anywhere that matters. Your bite was on the hand. That distance just bought you extra time you didn't ask for and don't know you have. Day 19, the first symptom. 19 days after the bite, you wake up with a headache and a low fever. You assume it's the flu or a cold coming on. There's something else too, a strange tingling, almost burning sensation right at the old bite site on your hand. The scab healed weeks ago. There's no reason for it to feel like this. You mention it to your partner, who shrugs it off as your imagination. This symptom, pain or tingling at the original wound site, occurs in roughly half to 3/4 of human rabies cases, and it's one of the only early clues doctors have to work with. It happens because the virus has now reached your spinal cord and is beginning to irritate the very nerve pathway it traveled up. Doctors call this the prodromal phase, a short window, usually 2 to 10 days, that looks almost exactly like 100 other minor illnesses. There's nothing about a headache and a low fever that screams rabies, which is precisely why this stage so often gets missed, by patients and doctors alike, in places where nobody thinks to ask about a dog bite from weeks earlier. You take some painkillers and go to bed early. You have no idea that the virus, after 19 days of silent travel, has just arrived at the edge of your central nervous system. From here, things move fast. Day 22. The diagnosis nobody wants to make. 3 days later, you're significantly worse. The fever's climbing. You feel anxious for no clear reason, restless, like your skin doesn't fit right. Your partner takes you to urgent care. The doctor asks the routine questions, then asks if you've had any animal bites recently. You almost forgot to mention it. It feels irrelevant. It was 3 weeks ago. the doctor's expression changes. Rabies is diagnosed almost entirely on clinical suspicion and exposure history at this stage because the lab tests that confirm it, looking for the virus in saliva, spinal fluid, or skin samples from the nape of your neck, take time, and by the time results come back, the disease has usually already declared itself in unmistakable ways. You're admitted to the hospital. The doctor doesn't say the word rabies to you directly yet. She says it to your partner, in the hallway, in a voice just quiet enough that you don't quite catch it. She orders a panel of tests anyway, just to be thorough, a process that involves checking saliva, serum, spinal fluid, and a small skin sample taken from the nape of your neck, where nerve endings cluster near hair follicles. Each test on its own isn't fully reliable. Together, run in combination, they're how the diagnosis eventually gets confirmed, usually after the fact, since by the time results come back from a specialized lab, the clinical picture has almost always already made the answer obvious to everyone in the room. Day 24. Furious. 2 days into your hospital stay, you stop being able to sleep. Every sound feels too loud. Light hurts. You're agitated in a way that doesn't make sense to you, snapping at nurses, pulling at the IV line. Then the water test happens. A nurse offers you a cup of water. You're desperately thirsty. You reach for it, and the second it's close to your mouth, your throat seizes up in spasm, a violent, painful contraction that makes swallowing feel impossible. You recoil from the cup like it's on fire. This is hydrophobia, the symptom rabies is named for throughout most of human history. It's not that you don't want water. Your brain wants it desperately. But the virus has damaged the part of your brainstem that controls swallowing, so badly that even the sight of liquid, even a breeze across your face, triggers spasms in your throat. Patients in this stage will often refuse all liquids, becoming severely dehydrated, simply because their own body has turned against the one thing it needs. This phase is sometimes called furious rabies. You're agitated, hyperreactive to light and sound and touch, occasionally lucid enough to be horrified by what's happening to you, and then gone again into confusion and fear. A nurse opens a window, and the breeze across your face triggers the same throat spasm the water did, a phenomenon doctors call aerophobia, fear of air movement, every bit as real and involuntary as the water reaction. Doctors describe this stage as one of the most distressing things they witness in medicine, for the patient and for the family in the room. Day 27. Paralysis. By now, you're barely responsive. The furious episodes have given way to something quieter and worse. Paralysis is spreading, starting in the limb closest to the original bite, working inward. Your breathing has become labored. The virus has reached the parts of your brainstem that control basic survival functions, heart rate, breathing, blood pressure, and those systems are beginning to fail, one at a time. Not every case looks like yours. Roughly a fifth of human rabies cases skip the furious, agitated phase almost entirely and go straight to a quieter form called paralytic rabies, where weakness spreads steadily through the limbs from the start, with far less of the violent restlessness, sometimes misdiagnosed initially as a different neurological condition entirely, like Guillain-Barré syndrome, until the full picture becomes unmistakable. Either path, furious or paralytic, arrives at the same destination. There is no antiviral that reverses this. There is no late-stage cure. A handful of patients in medical history, fewer than 36 documented cases, have survived symptomatic rabies, almost all of them through an aggressive experimental treatment called the Milwaukee Protocol, which induces a coma to protect the brain while the immune system tries to catch up. The protocol's most famous success was a teenage girl in Wisconsin in 2004, bitten by a bat, who survived against odds doctors gave at essentially zero, and who went on to graduate college years later. Even then, most of those rare survivors live with permanent, severe neurological damage. The protocol has since fallen out of favor in many hospitals because it so rarely works, and when it does, the cost to the patient's brain is immense. You are not one of the 30 or so people in recorded history who survived this. You are one of the tens of thousands who don't. Every single year, the overwhelming majority of them in countries without easy access to the vaccine you skipped on day 3. Day 29. The end. 29 days after a dog you didn't recognize bit your hand on the way home from work, your heart stops. Your family is in the room. There was nothing more medicine could do once the symptoms began. Only supportive care, sedation, and as much comfort as possible. The post-exposure shots that would have stopped all of this, the ones that work essentially every time when given before symptoms start, were sitting in a clinic 10 minutes from your house the entire time. They cost roughly $100 where they're cheapest, with immunoglobulin treatment running considerably higher in wealthier countries. You didn't get them because the bite seemed too small to matter. Roughly 59,000 people die this exact way every year worldwide, the vast majority from dog bites, the vast majority in parts of Asia and Africa where access to post-exposure treatment is limited or unaffordable. Almost every single one of those deaths was preventable. Not difficult to prevent, not expensive to prevent, relative to the alternative. Just a series of shots, started in time. If there's one thing worth taking away from this, it's not fear. It's a single rule, the one rule that actually matters here. Any bite or scratch from a wild or unfamiliar animal anywhere in the world gets washed thoroughly and gets seen by a doctor, the same day if at all possible. Not because every bite carries rabies, almost none of them do, but because the ones that do offer exactly one chance to stop them, and that window closes quietly, with no symptoms at all to warn you, it's closing. And somewhere right now, in a city you've never been to, someone is walking home at dusk when a stray dog stumbles toward them. They'll feel the bite, rinse it under a tap, and decide it's not worth the trip to a clinic. They have no idea they're standing at day 0.